Welcome to the MCAT Boss. I am Dr. Matt, one of America's most experienced MCAT tutors and med school admissions coaches. If you have a question, drop them in the comments. And let's chat about getting into med school. Leave a quick instruction box here. Drop your MCAT and Premed questions here and let me know what is stopping you from that white coat. All right, leave a quick one here. Drop your MCAT and Premed questions here, and let's talk about getting into medical school. All right, while we are waiting for the first couple of questions to drop in, it's a good reminder that if you are just now starting on your journey, in fact, let's do this. Let's disappear the text box for just a second here. And how can we do this? Let's go here and hide this text box here for just a second. All right, so haven't had a good little quick MCAT rant in a minute, so here we go. If you think that your undergraduate degree prepared you for the MCAT, unfortunately, you're wrong. It doesn't matter if you scored 100th percentile on all of your classes. It doesn't matter if you got an A+ in every single prerequisite course. It doesn't matter if you graduated top of your class with a PhD in biology or cell biology or biochemistry. The MCAT is really different. So if you're getting ready to take the MCAT to get into med school, you need to study for the MCAT. Do not ride on the coattails of your success in undergrad, because the MCAT is nothing like undergrad. It's not even like grad school in any of the sciences. It's its own thing. All right. Hopefully that is helpful in some way to someone, because I know for all of us who have ever had the unique experience of getting on a practice MCAT and realizing that just because you graduated with honors in an undergrad degree doesn't even prepare you for the sections that you know the content for, because MCAT is a contextual exam. It is not recapitulating direct recall of the facts that you learned, of the equations that you learned, of the solution techniques that you learned previously. So you do have to take some time and get used to it. All right, guys, drop those questions here. So we have been working on a new series here where we do essentially a mini lesson on a topic from the What's on the MCAT PDF. If you guys are not familiar with this, this is the ultimate guide. It is free. It is not something that costs you a dime. But the What's on the MCAT PDF is a list of topics that are covered on the MCAT. It's about 100 pages long, a little over 100 pages long. And if you thought that the MCAT was, some kind of easy walk through the park, like high school or college biology exam, it is nothing like that. And the breadth and the depth and the scale of learning every single topic in 110 page PDF, printed at quite small resolution, quite small font size, is nothing to be nothing to joke about, right? All right, guys, welcome in on the YouTube side as well. And welcome in on the TikTok side, guys. Drop those questions here. Let me know how far along you are in your, let me know how far along you are on the pre-med journey, or if you are a medical student or a physician. All right. And let's go ahead and swap out this header here. Let's see. Welcome in, guys. Drop those questions here. We're probably only going to be on for a few minutes today. So if you have a question, we have not done a live in quite a while. So drop those questions here. If we don't have any questions in the next like 3-4 minutes, we'll go ahead and see everybody in the comments. All right. Dylan, no, if you have a question, that is related to, med school entrance in general, or a topic on the MCAT, that's fine too. I'm not sure what you had in mind there. Yeah, somebody commented that they thought about going to med school, but after taxes in California, $400,000. Yeah. Unfortunately, the costs, in the, thank you guys for tapping the like button. I do appreciate it. The costs are, the runaway costs for getting an MD. They really truly are out of control right now. Especially realizing that in a lot of other areas of the world, the cost of a medical education is either very inexpensive or is free. It is unfortunately getting very, very, very hard to justify the kind of exorbitant, $500,000, very quickly approaching $500,000 price tag of an MD in the US. Do you think taking Gen Chem 2 at a community college will have any effect on my application? I took the rest of my courses at university with a 3.8 GPA. Dylan, that is nearly exactly what I did. Very similar GPA. And I also took a few of my science courses, especially when I was trying to kind of catch up on prerequisites, because I had started out the journey as a math major. I had to go and take courses that I had not taken at my main university. And for my case, I can say it never got brought up in any discussions with any med schools. To the best of my ability, I would suggest that it didn't impact anything, because I got interview invitations at almost every school that I applied to, and I had multiple acceptances. So I don't think that I don't think either one of those things. I don't think the 3.8 affected me. I don't think taking some of my courses at a community college affected me. I don't think either one. Guys, thank you for hitting the like. Make sure you are following if you are pre-med and you are looking for, some experienced advice from somebody who has been helping students to be successful on the journey of med school entrance for over a decade now. I've helped lots and lots of people get on the right track. So next question says, do you think having an MSW and years of work experience really make a difference in admissions? So as a person who went into the medical school application process with a different degree history, with a different sort of set of work and life experiences, a person who, went in with a, let's just say, more life experience than the sort of traditional 20-something-year-old applying to med school straight out of college or during college. I think it helped me to be able to frame a lot of my experiences with a lot of thoughtfulness. I don't think that it necessarily changed the calculus that the admissions departments were making when offering me a spot versus someone else. I do think that is possible. I can at least imagine that for some medical schools, they might either prefer to give away spots to more traditional students or prefer to give away spots to more non-traditional students. All I can reflect on is that I have helped tons of students over a decade to get in who were non-traditionals, and because we take a very proactive stance in pointing out why being a non-traditional is a strength and not a weakness, my impression is, if anything, probably a little bit biased towards favoring the non-traditional student, just because you have the ability to reflect on hardships and real life and work and all kinds of things outside of a school setting where either loans or parental involvement is kind of giving you that safety net. And I think that that is a very unique and valuable aspect that you should mention on your applications. Dylan says, do you think working for a family member or parent's practice is looked down upon by admissions committee? I don't think that that's necessarily going to hurt you unless you are only dealing with that as your sort of entire reference frame. I think if you have, you certainly would want to aim for a mix of clinical experiences, a mix of shadowing and volunteering. I would definitely say don't only make the family members or parents practice the sort of only clinical exposure that you have. I think that in general, it's a good idea as well to make sure that you have some kind of clinical exposure from more than one specialty. So I think that kind of covers it to begin with. Next one says, what is the best major in undergrad for med school? I want to do biology because I generally love it, but people say it's not unique. I would say if the thing that you're passionate about, the thing that you're interested in, the thing that you're curious about is biology, then there's absolutely nothing wrong with doing biology. It is probably true, though, that because biology is not unique, you probably are going to want to find some ways to distinguish yourself. Being completely realistic, when a medical school admissions committee is sitting there and they're looking at a folder with 100 applicants, and like, I don't know what the percentage of biology majors would be, but let's just say that if you cut it in half, say half the majors or biology, if you happen to see somebody there who has a major in like music history or say African studies or women's studies, or that somebody was, in my case, like mathematics major, you're going to be curious about what they bring, what perspective they bring, why they wanted to study, if they wanted to study women's studies, but then go into medicine, is this because they want to be, an OB, or they want to work in public health? There's a lot of stuff you would wonder that you might not get a perspective on if the person was a bio major. So if anything, add in some other coursework, maybe double major, or just find stuff that you're really interested in that goes beyond the standard biology degree. Nick says 3.92, 511 would you recommend MCAT retake to improve by 2 to 3 points. So Nick, I do get students who are in that bucket who do decide to retake because they are wanting to get into a school because they have a specific region or like an Ivy League school that they're interested in. And my advice is that it is possible, to push that score up. I regularly work with people. I'm the founder of MCATboss.com, and I regularly work with people who are on that journey of adding a few points. But I will be completely transparent and tell you that if you're only gunning for like a 2-point difference, that in and of itself kind of lies within the standard variation, the standard score variation range. And for a student to sort of fluctuate by a point or two per section is not super unheard of. And if you're only gunning for like 2 to 3 points, I would say you probably don't want to consider doing a retake, because if your margin is only a couple points, then you're probably close enough to apply anyway. But more than that, if your margin is only 2 to 3 points, you may be just as likely to score 2 to 3 points lower. To make a retake worth it, excuse me, to make a retake worth it, I usually tell students you want to aim for a 4-point difference minimum. Preferably, you want to aim for like 1 to 2 bandwidths on the AMC chart. And the bandwidths are usually somewhere in the range of 4 to 5 points. You want to be able to make sure you jump clean out of the current bandwidth into the next one. Otherwise, you're not changing you're just not changing the likelihood of your admissions by a whole heck of a lot. All right, next one says, let's see. Arno says, just found out score this morning. Went from a 502 to 508 as a reapplicant. Congrats. That is awesome. Wonderful, wonderful. Blake said, I had a 497 to a 511. Glad I retook. So that is a really, really strong retake. Very good. Very cool. Wonderful to hear. That is a really, really strong retake. So, I mean, you're looking at 14 point spread there. In that case, I would absolutely say, man, if you're putting in the work and your practice exam scores are showing up in the range of like a 10 to 15 point score improvement, then I think anybody would be crazy to not go for a retake with numbers like that. So, Blake, congratulations on the 14-point retake score jump. That is absolutely wonderful. And you have to give us an update and let us know, was that for an application that you had already turned in? Was this for an application that you're going to be turning in next cycle? Do keep us posted, because that is a really great success story. I would say probably about 65% of people that I work with are retakers. So this is a discussion that I've had hundreds of times, but it's a worthy goal. Blake gave a follow-up comment and said, I took 530, submitted July, waiting to get verified. Okay, so the wait for verification is definitely one of the hardest parts of the summer that you apply to med school. Although you think it is until you do an interview, and then while you wait for your first med school acceptance, I would say that is probably going to feel like a longer and more challenging wait than waiting for your app to get verified. But the good news is the application cycle is not done. And the even better news is that if you happen to be applying and your retake score has gone up by like 14 points, then you are in a really fantastic place. Now, one scenario that is I would say has become more popular over the last year or two is the students who are applying with a score that is already pretty good. So you're talking about like not a score in the 490s, right? Not something that's really hard to get in with. Not a score in the like 500, 501 range or something, but students who are scoring in that like 506 to 508 range, scores that used to be considered like a admissible score, not a desirable score, but an admissible score for some students who apply broadly enough with a high enough GPA. And I've had quite a few students in the past, maybe a year or so, who are starting off with like a 506 or a 506 to 508, and then applying with that score, and then going back and retaking and kind of like mid-cycle attempting to pull off like a 512, 513. So if you're on that retake journey, guys, let us know where you are and what you're doing. All right. Next, Karen says, planning to take September 4. Haven't gotten too much study time so far. Should I cancel or plan a retake? Oh, okay. So that is a little bit more of a complicated question. I'm going to kind of give you the Cliff Notes answer and then the slightly longer answer. The Cliff Notes answer is that if you have not taken very much time to study, and you're not in a scenario where you're already scoring pretty high on practice exams, I would definitely say you want to give yourself more of a runway than like 6 weeks. That's not a long time. It's just not. If you need help kind of like nailing down what a better schedule would be, the general answer is I'd probably aim for January. If you want to outline kind of what to do between now and January, drop me a line at mcatboss.com or matt@mcatboss.com if you want a direct email. And then, you want to give yourself your best shot, right? So anywhere from like 3 to 6 months tends to be the sweet spot for most students. Bobby says, I just got a 510. Is it worth retaking a 510? Okay. So, Bobby, the answer to that really, truly, like strongly depends on, it depends on what your goals are and what your sort of like limitations are in terms of where you want to go to school. Like a student who wants to get in to, say, a med school, a state school in the Midwest or the Deep South, a 510 is strong. You're, as long as you write a good essay, as long as your personal statement sounds decent and humble and you sound like an interesting and interested and dedicated person, as long as your GPA is okay, as long as you have your clinicals and your extracurriculars, a 510 is a pretty great score in the Deep South or in the Midwest. Now, if you're applying to like the Northeast or the West Coast, if you're trying to get into a California school or a New York school, chances are you probably do want to retake because that is not a super high score for those really competitive regions. Chris says, I'm terrified of failing the MCAT. My background is a fashion. I have no interest in medicine. All right. Well, if you are, if you're not interested in studying the science, then this is definitely a test that is unique. It's all right. On the YouTube side, Justin says my extracurriculars will drown me. Please feel free to let me know what you mean. If there is a particular question you have about extracurriculars, then let me know what you are what you're curious about or what you're concerned about. If you feel like your extracurriculars have some kind of gap or something like that, feel free to drop a little bit more detail. Guys, if you're looking for sort of like general advice about your application scenario or kind of get a ballpark for what it's like to apply with particular numbers or particular extracurriculars or clinical experience, if you have specific questions about your own application cycle, please feel free to include as much context as you are okay with sharing, because there are sometimes some very big differences between two very similar sounding outcomes. And when people get into the sort of general ballpark question and then they give us more details, it's sometimes kind of funny because the details actually do matter. Now, if you're looking for really specific help, drop a line at mcatboss.com. All right, guys, we will go ahead and wrap it up there in just a minute. On the YouTube side, working on the GMAT, feel free to let me know what kind of help you are looking for. Justin, just drop a line on mcatboss.com and let me know what you are looking for with your test prep support. All right, guys, we will keep it on for probably about 30 more seconds and see if there are any other questions before we wrap it up. And then we will wish all of you guys a very happy and productive day. Hope everybody gets a chance to have a successful study day or application day. All right. Karen says, any experience gained by taking the test is not worth it. Okay, so this is such a great question that I think I'm actually going to answer this as a kind of a okay, so this is a really good one. So Karen asks whether it's worth taking the MCAT to gain experience taking the MCAT. And I want to answer this one with a resounding no, but a nuanced no, because a lot of people go in and they take the MCAT once or even twice or even 4 or 5 times, believing that the experience of taking the test is valuable in and of itself and reflects some kind of sort of hard work or an attempt at doing better. And the problem is that med schools often interpret that as the exact opposite of what you might be going for. Rather than seeing this as an attempt to do the test and familiarize yourself with the test, they see the taking of a real official practice, a real official actual MCAT without the proper prep. When you score poorly, especially if you score poorly more than once, they see this as an indication that the student is actually not properly assessing their test preparation and their test readiness. And I strongly encourage you guys, do not go take the MCAT if you're not ready. If you're not prepared for it, please do not go take it. It is not only a waste of your time and money, it is oftentimes going to hurt you more to just go out and take it than it will to properly prepare before you take it the first time. If you need help prepping for the MCAT, or if you're a test retaker, drop a line at mcatboss.com. All right. I'm sorry that's a kind of long-winded answer, but this is actually a very good question, and it's a question that I get absolutely all the time, guys. This, should I take the MCAT just for the experience? And the bottom line is, if you're wanting the experience of like taking it and trying it out, it's totally fine to take a practice exam for free and then realize, holy smokes, I am ready, or holy smokes, I'm definitely not ready. That's what you should do. Don't go out and take the real thing and have that permanently on your record, okay? Dominic says, got my first interview tomorrow. Any tips? It's a recorded interview, so I'm kind of nervous because I'm basically just talking to myself. It's forwardly come. First of all, congrats on the interview invitation. That is awesome. There are a few different things that I recommend for people who are preparing for interviews. I think that you have to be comfortable answering the kinds of questions that you might not be prepared for with a little bit of a slower pace. And what I mean by that is, instead of rushing through an answer, you want to look like a thoughtful person, an empathetic person, and you want to be able to express those things when you're not able to have a pre-recorded answer in your head. And I think that's the hard part. A lot of people prep for interviews by essentially pre-pitching a bunch of answers for themselves to give in almost like a, I'm reciting this to you way. Now, that said, I actually think it's really good to try essentially prepping in your head answers to common questions like, why do you want to become a doctor? Those are the general questions that you should absolutely be ready to answer. You should be ready to answer that clearly and cleanly with empathy, with drive and determination. You should be like, I want to be a doctor because, and then give your reason, right? Was it life experiences? Was it realizing that you need to feel like you're impacting people on a daily basis? Was it maybe you're a nurse and you were loving being involved in medicine, but you were wanting to get more of that interaction with the patient's actual clinical decision making, and so you really just wanted to put the extra work in to become a doctor because you felt limited in your previous role. Those kinds of things you need to be thinking. Now, the challenge for people who are not used to getting new questions on the spot is that if they ask you a scenario question like, hey, what if you have to go into the room and deliver bad news? How would you tell me that my family member is dying of cancer. If something like that happens, a lot of students will kind of freeze up, or they'll say, and they don't have the ability to sort of refocus themselves and say, you know what, man, none of us wants to get bad news, like hearing that a family member has cancer. I would want to be the kind of provider that I would want if I were on the patient or the patient's family side. And so I would want to convey clearly to them what kinds of things do they want to know about the diagnosis. Do they want to be supported by family members when they're hearing it? And then I would cleanly and rapidly tell them the results of their tests indicated they had cancer, and that I want to let that sit with them and to ask what that means to them. I'd want to ask what they understand about the diagnosis and how they feel about it. Does that make them feel nervous or scared? What questions do they have for me, and how can I be the best support possible for them? Because it is understandably a very life-changing diagnosis. These are the kinds of things you really, really, truly want to be able to put into words calmly without a lot of pausing and hemming and hawing. If you're looking for more interview prep, drop me a line, mcatboss.com, and I'm happy to kind of give you feedback on the kinds of things that you're conveying through your interview performance. We go through sort of practice mock interview questions, including scenario-based questions and including more sort of general questions where you should have a pre-scripted answer. But don't use air fillers, don't use ums and ahs, and you just want to come across as a normal, nice, empathetic person who is there to make somebody's life better. All right, next one says, I have a question. If I have 4 C's but a 3.77 GPA, what should my MCAT be to make that better? That is a great question. It really kind of depends on what the C grades were and what they were in. So if they were in one of the prerequisites, I would definitely, sure thing, Dominic, happy to help. Drop me a line if you need to do a mock interview. I would say probably today, I could probably fit in one evening, like last minute, same day, session. If you want to do like an a la carte session or something, please do feel free to drop me a line at matt@mcatboss.com. All right. Okay. So for the question about the having C's on your record, but still having a pretty good GPA, like a 3.77, that is a pretty strong GPA. If you're scoring anywhere kind of north of like a 508, you still have a pretty good chance of getting into a med school if you apply broadly. If the C's are in a really problematic area, like a person who got all of their chemistry were scoring in the C's, or all of their bio was scoring in the C's or something like that, then that could raise questions, because that is very core fundamental topic content. And I would say if it was concentrated in something like, say, making C's in chemistry, then I would say the chemistry related sections would be, the physics and chem or the biochem. Those would be sections where I would say you really, really, really want to make sure that you are drilling down and doing really well in those sections, so that you can prove that it was just life circumstances, or that it was just a professor who didn't teach you clearly. You want to overcompensate in those topic areas. Next one says, Hannah says, what can I do to raise my MCAT? Okay, so that is a really, really, really general question. I've been doing medical volunteering programs. Yes, sure thing. Drop me a line if I can help. Okay, so to raise your MCAT, the medical volunteering is great. That's good, material for your application. To raise your MCAT, there's some general stuff you can do, right? You can, for example, do a lot of problem-based practice. There are other things you can do that don't feel like they're the MCAT. Getting used to reading more quickly is a really big part of doing well on the CARS section. And then, of course, there's some much more Okay, very cool, very cool. There's some much more detailed sort of procedural things you can do, right? There's some very structured ways of evaluating your practice problem performance on MCAT practice problems. If that is something that you are looking into, feel free to drop me a line at mcatboss.com. But generally speaking, problem-based approach tends to be the highest yield per hour of time spent compared to any other test prep approach. All right, guys, I will leave this up for about 30 more seconds, and then we'll go ahead and say goodbye on the YouTube and the TikTok side.